Hi, everybody. My name is Carl Bonnet, and I am the founder and medical director for Clarisana. And today I'm joined by my highly motivated assistant medical director, Dr. Adam Bonder. How you doing, Adam?
I'm doing great. Thank you so much for having me, Carl. I'm really excited to start these consults and to help patients learn more about ketamine and the psychedelic experience so they can have the best outcomes and experiences during their sessions.
Yeah, it's great to talk to you. So what we're doing is we're starting a new series of videos called Ketamine Consult, which is basically just about 5 minutes or so, give or take. That'll be very focused, looking at different elements of how we administer ketamine or the process in the clinics, or looking at recent literature, looking at ketamine or other psychedelic substances as well. So this is going to be fun. So for our first one, we're going to talk about the concept of the emergence reaction. So that's something we've heard a lot about in our history as emergency physicians. Adam and I are both board certified ER doctors, been practicing emergency medicine for a long time. And we've used ketamine in the emergency department setting for years and years and years for procedural sedation and whatnot. The therapeutic setting of what we're doing, using it for behavioral health, as we'll talk about in other videos, is fundamentally different. This is what we call ketamine for non-anesthetic indications, which is different than procedural sedation. But this concept still creeps in, especially with some of our patients who are clinicians and who may have had experience with ketamine in a sedation standpoint, or sometimes we see spouses, significant others of patients who will ask about this and with some concern, which could be justified. And so, Adam, tell us first, what is an emergence reaction?
Yeah. Thank you very much for asking. So an emergence reaction it's typically seen when people receive much higher doses of ketamine or anesthetics than what we provide in our clinics, that we provide very safely at a low dose that allow for that psychedelic and experience that gives patients this mental paradigm shift. And so what we find is that when people are inappropriately prepared for their sessions, typically it's one that we'll see after surgeries or painful procedures when patients who don't know what to expect and are not properly prepped prior to receiving the anesthetics and then receive a painful procedure, come out of it not knowing where they are, confused and agitated, and rightfully so if you had just gone through this rather mind-altering experience and then coming out on the other side with all these painful procedures and people you don't know in a setting you don't know, which is, I believe, what we've done a great job of helping to avoid with the setting that we have at Clarisana, right, Carl?
Right, right. Yeah, it's interesting from an emergency medicine standpoint. I found that most of the times emergency reactions were due to a junior resident who goes to a patient and says, "Hey, I'm going to give you ketamine. I'm going to kind of knock you out for a couple of minutes. We'll, do this procedure, whatever it may be." And they really don't explain, like, no, it's not going to just make you feel funny. I mean, I'm going to send you to Jupiter, right? Because when we use it in an emergency medicine standpoint, we're doing a fast IV push. The goal again is very different than what we're doing in our clinics, and we're trying to sedate someone very quickly. And when they come out of that, if they have not been prepared, oh man, that's I'd be in a pretty rough space if I'd never had ketamine before either. But how does that differ from what we're doing, Adam? I already mentioned that it's fundamentally different. This ketamine for non-anesthetic indications, but we still could have some issues if we're not careful. Do you want to kind of touch on that a little bit?
Yeah, absolutely. So one of the big things that you're going to hear over and over with ketamine for non-anesthetic indications, KNAI, is the mindset and clinical setting that patients are involved in when they're receiving these medications. So the set and setting. So we do a great job at making sure that we prep patients prior to receiving the medication to get them prepared for what they're about to experience and how to maximize that experience and how to delve in and actually hold on to what they're going through and actually turn it beneficial. That's huge. And then on top of it, we obviously provide a very comfortable setting for patients that is a healing setting and one that is relaxing and allows for great introspection.
Yeah. Yeah. So I think that's important to understand that when we do usually for most patients, a series of 6 sessions, this induction series, and we start relatively low, right? So the idea is to get you used to ketamine, to understand it. Is, in your first session, boy, you don't even know what game you're playing. I mean, it's just baseball or basketball or whatever. But then once you sort of figure that out and we start escalating, then for the most part, you really don't have an emergence reaction because you know what you're doing. You know why you're there. You know it's intentional, all this sort of thing. So yeah, I think it's not something people should necessarily be scared of in the clinical setting when we're using this for behavioral health. So Cool. Well,
Very
thanks.
different.
Yeah. Well, hey, thanks for your time, man. Let's talk soon, and we'll pick it up with the next topic later. I appreciate your time. And, yeah, I guess have a great rest of the day, Adam. We'll talk to you soon, brother.
Thank you. Take care.
All right. Bye.